Experts can't explain this case. Not because it was dramatic, not because it was chaotic, but because it followed none of the rules medicine depends on. This is the medical case that broke every expectation. The patient was admitted with symptoms that appeared ordinary at first. Fatigue, discomfort, subtle irregularities that didn't point clearly in any direction. Nothing immediately life-threatening. Nothing that suggested urgency. Standard intake procedures were followed. Vitals were recorded. Blood was drawn. Baseline imaging was ordered. At this stage, there was no reason to expect anything unusual. The first inconsistencies appeared in the lab results. Several markers contradicted one another. Values that should rise together didn't. Others that normally oppose each other moved in the same direction. Individual results, taken alone, could be explained. But taken together, they didn't align with any known diagnostic pattern. The tests were repeated. New samples were drawn. Different machines were used. The contradictions remained. Imaging added another layer of confusion. Initial scans appeared normal. No visible abnormalities. No structural damage. No obvious explanation. Hours later, follow-up imaging told a different story. Subtle changes appeared. Not dramatic, not severe, but enough to raise concern. Then, without intervention, later scans reverted back. Nothing permanent. Nothing progressive. Just change without continuity. Doctors followed established protocols. They ruled out common causes first, then uncommon ones, then rare ones. Each possibility was tested against the data. Each time, something didn't fit. Standard treatments were introduced carefully, adjusted slowly, monitored closely. None produced the expected response. Some had no effect at all. Others altered one measurement while leaving everything else unchanged. Then came the most unusual development. Measurements that are normally stable began to fluctuate. Not wildly, not dangerously, but consistently enough to be undeniable. Body chemistry shifted without a detectable trigger. Hormone levels changed without corresponding signals. Markers associated with stress, infection, or trauma moved independently. Yet through all of this, the patient remained stable. Alert, responsive, coherent. There was no sudden decline, no crisis point. Just a growing gap between what the data showed and how the patient actually appeared. Equipment malfunction was considered. Monitors were replaced. Calibration logs were reviewed. External labs were consulted. The data remained consistent across systems. Human error was considered next. Results were reviewed by independent specialists. Blind assessments were performed. Each reviewer reached the same conclusion. The readings were accurate. The inconsistency was real. Over time, the condition began to resolve. Not suddenly, not dramatically, just gradually. Measurements stabilized. Symptoms faded. Imaging returned to baseline. No single intervention could be credited. No turning point was identified. Recovery occurred without explanation. The case was documented in detail. Every test, every anomaly, every contradiction. It was submitted to medical records and archived. Not as a solved case, but as an unresolved one. A reminder that even modern medicine has limits. Not because knowledge is absent, but because not everything fits the frameworks we rely on. This case remains cited without a definitive explanation. No final diagnosis. No confirmed mechanism. Only verified data that refuses to resolve into certainty. Experts can't explain it. And for now, the record remains open.